I'm with Dr. Jeremy Bowl, the president of Mount Sinai Downtown and the chief clinical officer of the Mount Sinai Health System. My name is Dori Kleesis. Welcome.
Thank you very much.
So start out by telling us about the expansion of Mount Sinai in Manhattan.
Sure. So we are about 2.5 years into a transformation of the Manhattan assets that we have to create high volume centers of excellence for really complex care. So, you know, if you need something like neurosurgery or an organ transplant, we will provide those services in places where we do incredibly high numbers of those kinds of services. And so we have the best possible teams with the best experience. And while we're doing that, we're also vastly increasing and expanding our ambulatory footprint so that we're pushing out everything that doesn't need to happen in a hospital. We're providing it much closer to where people live and where they work.
Medical care has changed. People spend less time in the hospital, and we inherited Mount Sinai Beth Israel,
Yep.
and you're creating a transformation around that.
Yes, absolutely. So Beth Israel is this incredible, storied hospital in New York City that when we became a system back in 2013 was licensed for about 1,000 inpatient beds. But the reality is that inpatient care is plummeting in Manhattan and around the nation as care moves to ambulatory settings, as the time people need to spend in the hospital for certain conditions gets a lot shorter. And the campus of Beth Israel has aged significantly. And so, as stewards of healthcare assets in New York, our responsibility is to really build a system for the future. So we're in the process of getting ready to build a brand new Beth Israel, just a few blocks from the current one, that will be smaller, but really purpose-built for the future. So it'll have all private rooms and state-of-the-art interventional and operative suites and, a brand new emergency room. And we're incredibly excited to be able to offer that to the folks who live and work in New York.
And there's a big downtown presence. You have Mount Sinai Union Square, Mount Sinai Chelsea, and you don't stay in the hospital. If you have a surgery, you're out the next day, right? So there's support and care for when the patient goes home as well, correct?
Yeah, that's exactly right. Below 34th Street, where we're embarking on this downtown transformation, we have about 18 ambulatory sites, including one that you mentioned called Mount Sinai Union Square. That site is 300,000 square feet. It's got 30 multi-specialty practices in it. It's almost like a hospital without beds. Every type of specialty is there. We have diagnostic imaging, we have infusion services, we have ambulatory ORs there. Over on the west side downtown, we have the Blavatnik Family Health Center, which is really one-stop shopping for people with all sorts of different conditions, in particular certain types of cancer, where they can get medical oncology, surgery, infusion, radiation treatment, all in one location. And then all throughout downtown, we have all these other ambulatory practices. In total, we have about 600 doctors below 34th Street.
And that helps the patient. They have more access. And what other innovations are you overseeing downtown? Are you bringing technology into the environment?
Yeah, I mean, one of the things that we like best about the work we're doing downtown is it's really a big laboratory for innovation in healthcare delivery. So it's one of the places where we're expanding a model of care called Hospital at Home that was originally piloted up at Mount Sinai Hospital. And that's in a model where patients who actually are sick enough to meet criteria for being in an inpatient hospital, we can actually take them straight home from the emergency room and give them hospital level care at home. And a lot of that is because we can use technology to monitor them and make sure they're getting the right treatments at home, the right diagnostic imaging, the lab tests, all that kind of stuff in the comfort of their own home. We're also really going big into telemedicine and teleconsultation so that patients who are being seen in a primary care office, for example, downtown, can sometimes get specialty care right in their primary care appointment through a telehealth visit, or even in their own home through a telehealth visit.
Terrific. Lots of innovations through Mount Sinai. Thank you very much for joining us.
It's my pleasure. Thank you.